Welcome to Marriage IQ, the podcast for the intelligent spouse.
I'm Dr. Heidi Hastings.
And I'm Dr. Scott Hastings.
We are two doctors, two researchers, two spouses, two lovers, and two incredibly different human beings coming together for one purpose: to transform the stinky parts of your marriage into scintillating ones, using intelligence mixed with a little fun.
Welcome back, everyone, to part 2 of our interview with Joyce and Clifford Penner, two pioneering sex therapists. They've been around for a long time.
Yeah,
it
50 years.
A real privilege to be able to speak with them. This is part 2. We're talking specifically about details on sexual dysfunction in women that may create problems in the sexual relationship.
And men.
And also in men, and specific ways to adjust arousal and orgasm and deep intimacy and connection. In the first episode, we talked more about how we need to develop our own sexual identity. And they've had 64, of learning and growing in that. So I invite you to really go back and listen to that. It's very well done. We're just so glad to have them. And let's jump on into part 2.
I wondered, with your experience just over years, what are some of the most common sexual challenges that long-term couples or couples who maybe at the beginning of their relationship, but definitely want it to be long-term, what are some of the biggest sexual challenges that they face, and how can they begin to address those?
Well, let's start with one that may be a surprise, and that is these days and before also, a lot of couples struggle with physical pain. It's in the way,
especially
of their
for
sexual
women.
Experience. Yeah, and this is particularly true for women. And that's one thing that we get all the time.
Okay. And how do you help couples with that? Are you talking sexual pain?
We're talking
Yeah.
physical
Okay.
pain.
Great.
And that I've really become a specialist in that. And one thing that has helped over the years is pelvic floor physical therapists. And I'm not sure if you're aware of those, but
yeah.
it's very important. I usually do a bit of a triage over the phone,
Okay.
and then I refer the couple or the woman to a pelvic floor physical therapist and get an evaluation. And then with that information, then we move forward in terms of treatment. And sometimes all the treatment that's needed is actually working with the physical therapist, and they don't even need the sexual therapy. So I'm not building it so they are dependent on us or our associates or people in our field. The physical therapist may be the answer, that there's muscular tension there. There's some injury that has happened through childbirth or through a fall or something that has caused this pain. And when it's severe, it's a condition called vaginismus, where that's the most common reason for unconsummated marriages.
Now, let's just explain what we mean by an unconsummated marriage is that a couple are married and they've never been able to have intercourse because of this condition called vaginismus. Every now and then it can be something that the man is dealing with, but I would say 95% of the time it's what the woman is struggling with. So we regularly deal with unconsummated marriages from all over the world.
And that's one of those that we can say we've had 100% success when the couple or the person is willing to do the work.
Wow.
If they drop out, then no. But and that's when you can measure. They either are having sex or they're not. And one of the things we really recommend for pastors and counselors, if they're dealing with a couple that says, well, sex just hasn't worked for us, to be able to ask, have you ever been able to have entry? And if they say, well, we're not sure, or sort of, it isn't sort of, it either is or isn't. And when it has happened. So then you want to get that kind of evaluation and find out for sure what's going on.
Often people will come when they want to have children, and they might have been married 6 or 10 years and not been able to consummate.
They may have a very rich sex life without that, but now they want to be able to get pregnant.
So, I mean, for me, I'm not a woman. I can only imagine what it's like. But it may be very confusing for a woman because, we're teaching here that sex is very pleasurable and nice, et cetera. And for a lot of women, young women coming into this whole arena, it's marked with a lot of pain and maybe some confusion about pain and pleasure. And it can be, I think, just really confusing,
Mhm.
Yes.
Absolutely.
Yes.
that kind of messaging that goes through their brain.
Absolutely.
And what happens then is that many times the couple just pull away from each other, and then they'll try again and then pull away. And so it really affects them relationally and emotionally as well.
So it's
Mhm.
something we like to make sure everyone hears about and knows that this is something you can work with and you can find success. It may take a little more effort, and sometimes it's very discouraging to women saying,
Yeah.
teenagers can do this in the back of the car and I can't do it. And I'm intelligent and I'm educated and it doesn't work for me. And, I feel so embarrassed.
Well, I think for a lot of those teenagers in the back of the car, the girl is probably in a lot of pain,
And she's
That's true,
probably
too.
and she's only doing it
often in
because
a freeze state. If
because
you're looking
she-
at the fight, flight, or
Yeah,
freeze,
or
she's probably just
Yeah.
she
frozen.
just she
Yeah.
wants to be accepted or loved. But for
Yep.
a guy, it's never been painful. I can vouch for that.
Yeah.
Like
Yeah.
I've never, from moment one, it's never been painful for me. It's kind of not rigged, but it's hard for
Doesn't
women.
seem fair.
From
Right.
the beginning, it's
not.
not really fair. And so that's why I think that it just takes a lot more time for, generally speaking,
Yep.
Mhm.
for
I'm-
women to really get to know themselves.
Yeah. I'm just wondering how often in your experience is abuse part of this story?
Yeah, we often find that if there's been some kind of violation, either
Attempt at entry or whatever it is, that then the muscles have tightened up. And so that's another reason for the tightening. Yes.
So how do you help
So-
Then
with
you've got
that?
to deal with that trauma too.
So that's why I bring up the pain thing, because we always start there first. Then probably the biggest area that we get people coming to us about is interest or desire or the lack of interest on the part of one person.
Or a difference where one just has a lot higher desire than the other,
hmm
and how to deal with that. And again, how to deal with those differences and make those work for you rather than against you, and not impose how one of us is on the other, but finding a way to work that out. When we start, often, if there's one that came into the relationship more excited about it, or something happened that one pulled away a little bit, then it can feed the other. And a little bit of difference can seem way bigger than a lot of difference. For example, when a couple comes to us for therapy, we'll have a little form they fill out. And how often would you like to have sex? Often do you think your spouse would like to have sex? And the one who wants it more always says, well, we rarely have it. And the one who wants it less says, oh, that's all he ever wants. And we have it a couple times a day. And then we ask them, okay, so how often would you, separately, how often would you like it? Traditionally, it's not always this gender, but the woman will say, oh, maybe once or so a week. And he'll say, well, 2 or 3 times a week. So they're always surprised that they're not as far apart as they thought they were when they,
Mhm.
again, knowing yourself, the identity, talking about it.
Because often what's going on is the man doesn't want to miss a window of opportunity. So he's checking every 12 minutes.
Or the
you know.
the one who wants it more. And sometimes it's the woman. In fact, there's a book out that said, but what about me, that a woman wrote? She said, everybody talks about the man wanting it more.
Yeah.
What if I'm the woman who wants it more and my husband
Exactly.
doesn't? That's there too.
About 30% is what I think the numbers are of
Yeah.
women are the higher, more spontaneous.
Right. Right.
But you're talking about how sexual communication really is vital to having a really
Right.
good sex life, and whether it's been consummated or not. I love that you said those who
Mhm.
had consummated marriages may still have a great sex life.
Right.
I want to talk about that in just a second, but how do couples who haven't really talked openly about sex before take some of those first steps towards having that honest and safe conversation?
That's where we just encourage them to take a book and read it out
Okay.
loud.
All right.
It really breaks that barrier.
And,
And it's
and
so hard to break without that. I mean, there's other ways you can do it, but it's so much easier just to have
Yeah.
something there that you're reading and discussing as you read it.
well, and when couples come and we talk about it openly, it's
That also
amazing how
helps. Yeah.
quickly they adapt once they feel we're comfortable with it. And many times they've said, well, I tried to talk to my therapist about it, but I got the feeling it made him or her uncomfortable. So I didn't go back to it again.
Right. Last I checked the research, it said something like only 10 or 20% of therapists have been trained to know how to talk about sexuality with
Yes.
their
Absolutely.
clients. And so,
Yeah.
yeah, you're right about that.
Yeah. And that's something we do is talk to their
That's nice.
various therapy groups.
So, okay. So what I hear you saying is if the couple is struggling, just have that
Mhm.
third person, that book, like they talk in third person, right?
Or
It's
this
not,
podcast or something like that.
or,
Yeah. The podcast. Great.
yeah,
Mhm.
or have a third person. I like that idea.
So pain problems, desire problems, and then the next category we'd talk about is arousal problems.
And that is mainly ED for men. And that everyone knows about. It's on the TV every day. So I'm not sure. It's probably one of the most frequent.
I don't think we've talked about it too much on here. So talk away, however much you
When
want.
we talk about ED, we're talking about erectile dysfunction, where a man has difficulty either getting aroused or
Keeping
can
it.
get aroused, but then can't stay aroused long enough for a full sexual experience.
And with that, we always start, just like with the pain, we start with a physical therapist. We always start with a male sexual dysfunction MD evaluation. So we don't assume it's psychological, or even though by the time they come to us, it probably is, because even if there's a physical basis for it, by the time they come to us, they probably do need some sexual therapy also. But we always want to start with making sure, because sometimes it can be a sign of another, like, cardiac condition. And actually have had experiences where the guy has gone in for a triple bypass the next day when I said, get evaluated by your MD first. And so we first want to rule out any physical medical reason. And then there are many things available to help with it now. We have oral drugs that help with getting and keeping erections. So
Yeah, and I have several women I've talked to whose husbands deal with ED and they refuse to take medications. I think there's so much shame surrounding that.
Mhm.
And it seems to me like this is an easy fix. I think this
Yeah.
would really help. What do you
Yeah,
do to help
because
them not feel that shame about going and talking to a doctor about it?
Right.
if we understand the reality, men reach their peak of testosterone around age 25, and then it begins to reduce at a rate of 1% per year
On the average.
on average. When you're 50, you only, or 75, you only have half as much testosterone as you did when you were 25. We always kiddingly say, and then when you get to 125, you run out and you die.
What's the sense in living without testosterone, right?
Yeah. Scott's a physician, and I know, Scott,
Right.
you have some of your patients, I'm sure, that talk to you about it. Are they nervous about that, or do you sense they are? What do you do to help them feel more comfortable that this is not a thing to be ashamed about?
I say this is really common, very common,
Yes.
especially as you get into your 40s, 50s, 60s. It's pretty much every man is going to have some problems with their erectile function.
Yep.
And it's nothing to be ashamed of. It's,
It's
everyone.
part of life.
And
We're
there are medications now that are no longer really expensive. You can get them for pretty cheap because they're generic.
Yep.
And you can literally get, 30 tablets that used to cost $1,200. Now it's $10.99 at the pharmacy. And there's just simply no reason to not address that in a relationship. I mean, that is an easy peasy fix. Well, I mean, there are side effects and things that you need to talk about. The potential side effects, not everyone can take it. There's other medications you cannot take it with. But yeah, it's a relative, and it also helps your prostate too. So for guys in their 50s and higher out there with enlarged prostates, that's a 2-for-1 deal. You get help with your prostate and your erectile function.
There you go. Great.
Now, most of the time, the research has shown that women will get aroused when they have sexual stimulation, even if they're not aware of it. By that, we mean the physical signs of arousal will be there, the engorgement, the nipple erection, all of those kind of natural bodily responses that occur. But often women will not be aware that those physical responses are happening.
And
Yep.
they may say, I just don't get turned on. And yet, if an evaluation were done, or you ask them the specific questions about their body, it's getting turned on, but they're not.
They haven't
They're
learned
not
how to
getting
connect
with their
their
body,
emotion with what's going on
their
with them physically.
sensations. Right.
Correct.
So how do you help them do that?
This sexual therapy process really helps
we
with
should-
that.
What we do in sexual therapy is about 2/3 of the experiences we take people through are about physical touch, sensate focus, starting far away from breasts and genitals, just feet and hands, face, back, and then including more and more, as we call it, retraining to help couples find a new way to discover their sexual responsiveness.
In our book, Restoring the Pleasure, that we updated in 2017, is that whole process of sexual therapy or sexual retraining that couples can do on their own, but also trained certified sexual therapists will use that, have the couple follow that while they guide the couple through that. And it really is a process of trying to reduce demand, enhance the mutual pleasure, and facilitate the natural physiological responses in the body. So that's what sexual therapy or sexual retraining is about.
So then once we're dealt with arousal issues, then we get to what we call the orgasmic issues.
Or responsiveness.
And for men, that is mainly something called premature ejaculation, where the man ejaculates very quickly before he wants to, sometimes even before entry, but often within seconds after entry.
And that usually is just how he's trained his body. And we find that our body's physiological responses sexually are very easily conditioned and self-perpetuating. And so that's when we're taking them through sexual therapy or sexual retraining, we have them stop all sexual activity as they're doing it now and start over and retrain their body. Because if they keep doing it, like if he keeps having experiences where he's ejaculating too quickly, his body won't learn to hold on to those sensations without moving ahead. And so that's why they need that process to get there.
For women, it's the opposite side. There are a lot of women who say, I have difficulty having an orgasm. The majority of women have their orgasm from external or clitoral stimulation. And that's just the reality.
67 to 70%.
All the research has shown that. And sometimes couples will come in and say, we're not successful sexually because I, the woman, can't have an orgasm during intercourse. And we always try to sort out whether that's because the man wants her to or because she wants to. Because sometimes it makes the man feel like he's not a good lover because he doesn't bring her to orgasm during intercourse, when in fact, that's the majority. So,
yeah. So just helping them know, we say we can help you learn to be orgasmic during our intercourse, but we wouldn't see that as a sexual dysfunction or a necessity unless that's something you really want to learn and it doesn't put demand or pressure on anybody.
What we so often hear from women is that they can get aroused, but they can't take it over the hill. And this is where the body has to shift from
the parasympathetic nervous system, the passive side of our involuntary nervous system, to the active. And women tend to be more passive and men tend to be more active. And thus we believe that's why men have more difficulty with premature and women have more difficulty letting it happen. So we teach the man to learn to be passive and the woman learn to go after.
And so one of the main things that we help women with is help them to get very active rather than just being there and hoping it happens to them. So we teach them to go after it rather than
Actively, physically with their
When you
bodies.
say go
Yeah,
after it,
what does that look
what do you
like?
mean?
What does that mean?
Yeah, getting active during the sexual experience rather than laying like on her
Well,
back
for,
and
for
just
example, it could be that it's going to be better if the woman is in the top or superior position and she can be more physically active going after what feels good to her. It could be that she would
Or
use
even
her
just-
hand to stimulate the clitoris even as they are having intercourse. Or it could be that she extends her toes and or throws her head back, or all the things that are natural orgasmic responses.
there we have a list of orgasmic triggers and practicing. We get her to practice those.
Ah,
And again, just using her body, rubbing against him, just getting, rather than laying passively back and kind of, give me it. She'll say, my husband doesn't know how to give me an orgasm, as if it's his job, or he'll say, I don't know how to, rather than listening to her body and going after what would feel good to her.
One of the differences there is that many women didn't grow up masturbating, whereas most guys start masturbating around age 12. And by the time they are married, they've probably had 500 or 1,000 ejaculations, and they know the system. It's one of the reasons why they ejaculate so quickly, because they've practiced that. And whereas a lot of women have not been familiar with that part of their bodily responses.
Well, that's something new to think about.
Right.
All these things as far as the sympathetic, parasympathetic nervous system between men and women. I'm going to have to go. I
and
wanna
shifting to what is different than your natural state.
Yeah, like the woman's kind of driving the car now or the bus or what. She's in control. She knows it. That baton has been passed to her, right? Where she knows now that, oh, I'm in charge. So
That requires using some sexual agency there.
well, yeah, and also it requires some thinking ahead of time, some creativity, maybe, because when you have that baton, it's like, I got to run now, right? And you can't just let someone else do it for you. You take control over your own agency.
Then I just want to finish with the main areas we deal with. The other big area is sexual addiction. And that's been particularly true since the internet is available. All of us we walk around with 2 billion porn sites in our telephones, and it just causes lots of trouble.
That,
Not me. I have no internet on my phone, so.
Great, that's great.
I see.
He wants to be a righteous man and protect himself, and I don't force him. I don't
So
push
I've
him.
told her, take it off.
Yep.
Don't let me get it back on there.
Yeah.
It is hard.
That's
We do
often
talk
what-
about pornography and related topics quite a bit on here, but anything you might want to add from a sex therapist?
Well, the main thing I think we would add is that often they come to deal with this when they got busted, when they were caught, either by an employer or by a spouse or whatever. So the first thing is getting control of the addiction, but then they have to also learn how now to relate,
how to be intimate.
intimately.
And that's where that formula for intimacy really helps. Often they have a hard time with eye-to-eye contact. And we'll have them practice doing silly stuff like Google eyes because they get so uncomfortable with doing it seriously. So we have them do fun little bit. The formula for intimacy is very helpful because addiction is really the opposite of intimacy.
Yes. In my studies, definitely a lot of women said what was more hurtful even than the fact they've learned or discovered that he was viewing porn was that he didn't talk to them, didn't touch them, didn't want sex with them. Half the women in my study showed that. So yeah, it really does have some negative impacts on a couple's sexuality.
Yes.
So those are the big categories that affect the sexual, and then there's all the relational stuff. You know,
can get in the way
people
too.
come with unresolved trauma in their past because of abuse or something, or if they come with some bad hurt from some prior relationship,
or even in their relationship, things that have gotten in the way. But
Yeah.
that could be all kinds of things that I'm sure you deal with.
One last question for all of you. This has been so great. One thing that we haven't really tackled as much on here when it comes to sexuality is some of these things that would lead people to a sex therapist. So this has been especially helpful. If there's any advice that you can give or wisdom that you can give a couple who may be struggling a little bit, what would that be?
First thing we'd want to make is a general statement that it is our experience that when people are willing to work on it, they don't have to be stuck with their sexual issue. They can get past it. It can be resolved. Any of these things are because God designed us to be intensely sexual, responsive people.
Mhm.
But stuff has gotten in the way of that, whether it was how we were taught in our home or experiences that we had or things we heard or read. So,
Well, and sometimes when I hear us say that, I think of a number of women who over the years have said, that's a lie. God did not he missed that in me.
that computer chip out of me, because
And yet we would say, when we really are allowed to get into there's a reason that got blocked. That's not God blocking it. It's something in the world that blocked that. Some hurt happened. But
I love
if
that.
if you're listening and don't believe that, we're not going to force that on you. You just need to, when you're ready, find that door.
And is there any kind of an organization that allows people to look for a specialist, a sex therapist, if they feel like
the
they need one?
organization is right here.
You too. It's your organization. So do you have a
Well,
website?
What I mean is,
It-
people call Joyce. We
we
get
give
emails every day.
we give our number and our email address on our website for questions. And I'm not seeing clients anymore. Cliff is very, very little because we're partly retired, but I still take all the calls and do kind of a triage and then find someone. And we have lists we call our professional resource list for sexual therapists around the country and some around the world.
And are you okay with us sharing that phone number and email address?
Yes. Yeah.
Okay.
That's our home office now.
Okay.
So we're on the West Coast, so only between 8 a.m. and 6 p.m.
Every now and then we'll get a call at 5 a.m.
Or maybe we just give them the website address.
I think the website address
Yeah.
is the best way.
Yeah,
That's
because
Okay.
then they can email.
passionatecommitment.com.
Passionatecommitment.com. And on there, they'll find the books if they want to start with a book
Yeah.
first.
That's where they can also send us emails to
Yeah.
in terms of any question that they might have.
Right.
Wow. What a wonderful resource.
Joyce
And
literally
to you
does this
listening,
every day.
if you email me or call me and I don't answer right away, be patient. We were gone for a couple of weeks, and oh man, people were. I guess you just don't want to answer my question.
Oh, but you travel too still, right?
Oh, yeah.
You're still active in your 80s?
We've
Oh, yeah.
got a big family, so
Well, we're active, but we also do seminars and be at American
And take
Association of
vacations.
American Association of Christian Counselors in Nashville.
Oh,
We're heading up the
great.
human sexuality track.
Wow. That's wonderful.
Well, in fact, fun story. There's a group called the Institute for Sexual Wholeness now it's Dallas. Used to be in Atlanta.
We'll have to find
And-
them.
yeah, that's a great organization also to find sexual therapists, the Institute for Sexual Wholeness. And I think it's sexualwholeness.com.
Okay. That's a great resource. Thank you for sharing.
The people that go through that course have to take 6 30-hour courses, and we teach the last of those courses. So for those, when you asked, are we still doing stuff? We have 3 days where we are on our feet for 10 hours a day teaching. And
It's every 2 years. So we don't know. It was last
it was a year ago.
year ago.
Yeah.
So
we said, I
and
wonder if
another
we can
year
still
when-
do this. We could. So now we're going to try it again next year.
We're all very impressed that
Okay.
at our age we could stand there for 10 hours and teach, but we love it.
Yeah.
And I think that's when you're fulfilling what God called you to do. And it's so rewarding and so we
Energizing.
feel like we
Yeah.
can make a difference. You
Yeah.
want to keep doing it. So
Well,
That's wonderful.
Clifford and Joyce, this has been such a treat
A
for
pleasure.
us to gain your insight, your wisdom,
Mm-hmm.
your knowledge. We do this a lot, and I was just picking up on a lot of things I can do here. And we're just so grateful for the time you've taken today to spend with us, and hope that our listeners can do the same and reach out to you if they're interested. And folks, that wraps it up today for this episode of Marriage IQ. We look forward to seeing you next time on another exciting episode of Marriage IQ.